It's all about sleep. I'm here with Dr. Toshi Hart, who I'd met a few years ago, and somebody who's very well informed about sleep. So if you have any sleep problems, and we will be talking mainly about adults, but I think there's some room to talk about pediatrics there. In terms of Dr. Hart has a wide range of experience and looking at sleep across a number of different dimensions. So you're very welcome, Toshi. And maybe just kind of a brief introduction so that you're living in Walnut Creek in California, which sounds absolutely fantastic. And
It
just a little bit
is.
about you.
I was raised in San Francisco, and so I do not come from a family of dentists. I'm kind of an outlier. I spent many, many hours in the dental chair with lots of cavities. In fact, I hated going to the dentist. And I'm not, I kind of fell into dentistry. I fell into it very, very intensely, and I was very good with my hands and liked to help people. So I did public health for about 6 years. And so I set up a dental clinic, and then I was lured into private practice, a pediatric practice, and it was probably the very first pediatric practice in California. And so it was wonderful. I was there for over 25 years and helped a lot of families. There were wonderful families that grew the agriculture for the United States, the farmers, the nut growers, the cattle, the farmers. So it was an
Mm.
agricultural area. And so with that agricultural area, it's away from the coast. So we had poor air quality, and there were a lot of pesticides in the air. And throughout my 25 years there, I filled a lot of cavities. In fact, I'm hospital trained. I trained at the VA in Palo Alto, and also I trained through Stanford. And so I was very comfortable being in the hospital working with medical doctors, and I kept my hospital privileges. And unfortunately, I had to take care of these children, uh, having them in the hospital to do full mouth dental work. I'm talking 16, 20 teeth at a time.
Wow.
Rampant, we call it rampant dental decay. And it was really, it was disheartening because I would do this work. It was, I would advise on brushing, flossing, good habits. And about 2.5 years later, these kids would come back into my office and have recurrent decay, which means the cavities all over again. I would be having to do the work all over again. And after many years, I would wonder, well, why is it in a family of three, there were two siblings that were just fine. They hardly ever brushed or flossed. Their habits were just
Sure.
atrocious, but they had the same food. And but the third child seemed to always get cavities every 6 months. This poor child would have to have a filling or two, and I would feel so bad. And it led me down this pathway of questioning why. Why do children get cavities? So I was invited to attend a lecture at the American Sleep and Breathing Academy, and Dr. Dave Singh was there, and he talked about craniofacial development or underdevelopment, small jaws, and how these small jaws can inhibit space for the tongue. And that light bulb, and I said, that's the reason. So immediately from that lecture, I got involved in a group that helped children, and we placed orthodontic positioners in the mouth. And it took me a couple of years to gather the data, but I took 80 children. 40 of them, I put these positioners that sealed the lips and encouraged them to nasal breathe and also straighten the teeth. It was a wonderful appliance. And these kids, 40 kids, I had 40 and 40 in a controlled group. So the whole study was 80 children. And of these 40 children, 76%, 76, had a decrease in cavities. And it
Mm.
was astounding. Actually, I thought the numbers would be higher because once I got the lips sealed, I trained them to get their tongue to the roof of the mouth, get them to nasal breathe, that whole nitric oxide production and basically the neutrality. They had a more of a moist mouth. The saliva is a buffer, a neutral environment. That bacteria love a dry, acidic mouth. And no matter how much you brush and floss, you have the best habits. And it's very interesting in my experience. I can kind of give insight on children because I think this is a real problem. I mean, I was one of those kids,
Yeah.
right? I lived in a fluoridated city, but I had a ton of cavities. But my architecture, my jaw was small, being Asian. I have a short cranial base. And so what that means is a small jaw, I have a big tongue. And so I did a lot of mouth breathing. I'm still a big mouth breather, but that kind of explains why these children have cavities. And so when that study got completed, I really lost the drive to do any drill and fill traditional dentistry. I wanted to get to the root cause. And so that led me down to teaching for this organization and educating dentists that it's more than just filling teeth. We've got to look at the whole cranium, the whole head and neck structure. And so, one of my friends wrote this wonderful book. His name is Dr. Felix Liao, and
Mm.
his book is 6 Foot Tiger, 3 Foot Cage. 6 foot tiger, 3 foot cage. And that just simple analogy, that simple tiger title of your tiger, which is your tongue, crammed into your small jaw, your 3 foot cage. And so what happens is children who have perhaps they start out with maybe, and believe it or not, it starts in utero. This problem starts in utero. Mom has got to be able to nasal breathe and have not have issues with oxygenation. I think I'm just a dentist, but I think pregnant women should consider getting a sleep test during their pregnancy, make sure they don't have any apnea. A lot of the weight is associated with that, and there are many aspects about that. But when these babies are delivered, if they're tongue-tied, they're not able, and the tongue tied is a skin that is underneath your tongue that restricts the movement of your tongue. So if a baby is tongue tied, they're not able to nurse. And nursing is a problem, or lack of nursing is a problem because nursing grows the jaw forward, okay? And the push and pull of the nursing, where you have lip seal and tongue strength, tongue suction, allows the baby to grow the jaw. So in essence, when you get the tongue to the roof of the mouth, the teeth spread out, and you have enough room for the teeth. And when you see a child that's 2 and has teeth that are tight together. We call that the Hollywood smile. That's incorrect. Each child should have a nickel-sized gap. A nickel is in the United States, it's about this big.
A
A
penny.
nickel-sized gap, a penny, there we go, penny-sized gap between each and every tooth. Lots of gap because the permanent teeth are twice as big, sometimes bigger. And so these children must have gaps between their teeth. And if they're tongue-tied, then you don't have the growth and development of the jaw. When you have a small jaw, then these poor children have to rescue breathe. They're not nasal breathing. They're breathing more through their mouth, especially at night. They have enlarged tonsils and adenoids, and then they snore. A child snoring is not normal. A child should be sleeping silently, still, nasal breathing with the lips closed. But often children are tossing and turning, often cranking their necks or sweating. They have uh, nightmares. They go into different phases where some even have night terrors or sleepwalk, sleep talk. And so they're just struggling to breathe. They're rescue breathing. So, in the United States, unfortunately, the only answer to these children that have large tonsils and adenoids um, is often surgery. But we need those tonsils and adenoids to filter out lymph and throughout our life. They only become inflamed due to that mouth breathing. So anyway, the progress, it all starts with the child and nursing and looking at the ability to nurse if there's any tongue tie restrictions. And then with these devices, they're called orthodontic positioners. You can use them as early as age 3 years old. And if you can't use a positioner, what I encourage patients to do is look at what's called myofunctional therapy. So that's tongue therapy. You can work with a therapist, which is ideal. It's a one-on-one physical therapy. So myofunctional therapy is just like when you have a procedure done and you do physical therapy, you work with a therapist in the mouth, and it is a trained specialist that obtains proper tongue posture. So our tongue should be living on the roof of our mouth. On the roof of our mouth, if the roof of the mouth is very high and narrow, so for example, this dimension, then it takes up space in our nasal cavity. So we don't produce that important molecule, nitric oxide. So when we have a flatter palate by nursing, or orthodontic expansion, then we create more nasal uh, area to exchange nitric oxide, and that's what delivers oxygen to the cellular level in our body. So it's important from birth, even in utero, all the way through the elderly. And now, I was approached by, after 25 years of working in Modesto and doing dentistry and trying to get to the root cause of cavities, I was approached by my instructor at dental school to take over his dental sleep medicine practice. So that's how I moved recently to Walnut Creek, and now I see adults. And these adults are adults that have failed CPAP. They have a serious disease. It's called obstructive sleep apnea. And because of, my origins of working with children, it's exactly the same. It's that 6 foot tiger, 3 foot cage. So what happens over time is, when we're young, the hormones, especially for women, I could talk about women, the hormones that keep our airway open and taut, we lose them over time. Okay. And progesterone, especially, and estrogen. And so as we age, we lose muscle mass and tone. And women later on in menopause, perimenopause, we have the same incidence of men with sleep apnea. And that's unfortunately a hormonal thing, but also just progression, losing mass and tone. So this is where the myofunctional therapy will help. You can actually exercise those airway muscles to keep your airway nice and taut, just like you would go to the gym and work out. You want to work out your tongue, proper tongue and lip postures. And again, working with a therapist and learning how to nasal breathe. Our nasal cavity is just so important, as you know, and you teach, Patrick. And so with these oral appliances, I have to ascertain if the patient is a good candidate for an oral appliance. And many people who have sleep apnea are prescribed what's called a CPAP. A CPAP is a gold standard. It's basically forced air, 100% air, oxygen into the nasal cavity and sometimes the mouth, depending on the design of it. And that keeps the airway open. You don't have the collapse where that tongue is falling back into the airway. And there's severities of sleep apnea. You can have mild sleep apnea where your tongue falls back 5 to 15 times per hour for 10 seconds or more. Moderate is 15 to 30 times. And so severe is 30 plus. And I've seen 30 plus up to 100, and it's not good for your body. You have lack of oxygen to your vital organs, your brain, your heart, and all the systems in your body really can't survive without oxygen. There's really nothing more important. And the main area you produce that is in your nose, as you know, and nitric oxide. So with these oral appliances, there's various designs, but it basically makes the jaw bigger, gets the tongue out of the airway. So it goes back to that 6 foot tiger, 3 foot cage, because as a society, we are on our seventh generation of small jaws. So we're
Seven
on our
generations of small jaws. Wow. So that's over what, a span of about 250 years or so.
Oh, I think it's more than that. I think it's quite a bit more than that. I think it's under since you think of Cro-Magnon man, they were hunters, gatherers, they had huge jaws, big nostrils, they were pretty robust people. And indigenous societies today, you can see that where they have a more rough diet. They eat more dried and cured meats. They don't have refined soft foods. So our modern society has really debilitated us, this industrial revolution where women went back into the workforce and we're not nursing their young, and we have now soft processed foods. And that's a whole other discussion
Mm,
of the
mm.
processing, right? Because for various factors. But yeah, we're on our seventh generation of small jaws, big tongue. Big tongues creates problems later on in life, such as apnea. And so my focus right now is helping these adults, keep their airway open at night. And for those adults that can't tolerate CPAP, and we place devices that reposition their mandible, and I really enjoy it. It's very fulfilling to have a patient that has not slept in months. It seems like, they're exhausted. They're not able to do their daily activities. Perhaps they sleep for long periods of time, but really just don't get that restful sleep. They wake up tired and they're not able to work or even drive a car safely. And so when we do analysis, and that's another thing I really wanted to talk about, is that we have to look at the whole head and neck. And there's a specific imaging that I do that is uh, three-dimensional cone beam tomography to really figure out where the jaw should have grown in the first place, and then to allow the body to have an open airway. So if you look this way, the airway can be very pinched off even during the day. And when we move these jaws forward, not just forward, but in 6 different dimensions, yaw, pitch, and roll, we get we get more alignment of where our jaws should have grown from infancy and maintain an open airway. And that's the most important thing, is having oxygen day and night. There's nothing more important than that.
For sure, for sure. Um, I think the dental industry has an enormous role to play in sleep. I also feel the dentist has an enormous role in recognizing oral breathing, mouth breathing in children. I too was a mouth breather just like you. I had a mouthful of cavities, and I never realized back then it wasn't necessarily related to diet. So, just as you explained, the child with the open mouth is breathing through it. This dries out the mouth. This impacts then the bacteria inside the mouth. So, I think there's an increase in Streptococcus mutans. There's also a higher plaque index. So, the whole
Yes.
bacteria in the mouth has changed and altered. And as a result, then the child is more likely to have dental cavities. And very often, the dentist will ask the question about whether the child is brushing their teeth, or if they are flossing, or if they are eating too much sweeties, as I've heard. And no attention is paid to whether that child is actually breathing in and out through the nose or in and out through the mouth. So, saliva helps dental health. So, literally, I think what you said was you could be brushing your teeth, you could be flossing, but if you're going around with your mouth open, you're more likely to have poor dental health. Okay. Then we went one step further. You talked about the importance of nose breathing because you're able to have the tongue resting in the roof of the mouth. And during the formative years is the pressure exerted by the tongue, which helps to the forward growth of the jaws. And part of that, of course, is breastfeeding, because when the child is breastfeeding from the mother, it's also helping to manipulate the muscles of the face necessary for craniofacial growth. So then we tied in, we said, or at least you say, that you get forward growth of the face, which in turn is opening up the airways. And then that reduces the risk of that child as they grow into an adult having sleep disorder breathing. And then you talked about
Correct.
working with your patients with sleep disorder breathing and the impact. So bringing it just to that, the how common it is, Toshi, is absolutely unbelievable. And if we were to look at people with sleep apnea, so I suppose in typically, I think there was a Lancet review by Malhotra, and he estimated that 936 million people on the planet have obstructive sleep apnea. And of that, 85% don't get diagnosed, only 15% get diagnosed. And of the 15% that get diagnosed, 40% take up the treatment of a CPAP. And of the 40% to take up the treatment, 50% abandon it after 3 to 6 months. And then the next standard of treatment is the positioning devices that use. So basically, it's a dental device that's constructed to suit the patient, and it's helping to bring the lower jaw forward to help open up the pipe, open up the airway.
That's
Can
correct.
can we look at women's sleep? I actually think I'm just a little bit kind of I was looking at women's sleep more recently, and this gets hardly any attention. Upper
Yeah.
airway resistance syndrome in females, if you're comfortable with that. And let's talk about women for a moment, because I think this is a conversation, because the symptoms, it seems that women having sleep disorder breathing are different to men. And also women don't necessarily to be they don't necessarily have to have full blown apneas or hypopneas. Um, so can we just talk a little bit women's sleep?
Women's sleep. So I think I'm a perfect living example of sleep disordered breathing with women and upper airway resistance syndrome. So while I was working in my previous practice, I was so for decades, I was so exhausted. I had very, very poor sleep habits and even had a bed in my private office where I would, get to work somehow. I'd be able to work 4 hours, but I'd have to take a nap during lunch hours. I'd miss so many meetings, and then that 40-minute, 45-minute nap got me through the next 4 hours. And it was like I was living from nap to nap to nap. By the time I got home late at night, I had already, after work, I had, and after my after dinner nap, I would have had at least 2 to 3 naps. And by the time it was bedtime, um, I really wasn't sleepy at all. I had terrible insomnia. So this went over and over. And I think that has to do with also um, circadian rhythm issues. You have to have good sleep hygiene habits, making sure you go to bed at a certain time, hydrate, have enough exercise. But as far as and I really do think a lot of this is hormonal. The women, we have children, we have there's a huge influx of hormones during pregnancy and delivery and then afterwards, and just our bodies, we're not made the same as men. And so I think, and we often do not test positive for sleep apnea. And most of the time, women don't get any treatment. And so what happens in the medical world is that women are given an antidepressant or a sedative to sleep. It's all medicated, and they're not really getting to the root cause, which is often lack of nasal breathing. Lack of nasal breathing and the inability to understand that while one is mouth breathing in addition to the hormones that are fluctuating throughout your life, throughout your childbearing years, and then they deplete after a while. We run into another set of problems. So I think actually women have it so much harder than men. um, and we never get diagnosed. I think that and it's not very feminine for a woman to say that they snore, right? Or Right, and that it is societally, it's just men snore. But women do snore. They have that tone, lack of tone, loss of the hormones, and so we suffer greatly. And I think that women need to be screened and treated earlier, and if and possibly even get into therapy such as myofunctional therapy, and learning how to nasal breathe, learning your exercises that will help women to decongest, right? And get into proper cycles of sleep, and basically get to the point where they can function and do all the things we're supposed to do, have a career, be the mom, the wife, and all of those things. It's just a lot of pressure. And so I think that women are the most underdiagnosed. They're often medicated by the medical community. And I have many women coming into my office that test
Mm,
very low. Their apnea is 5, but the respiratory disturbances could be 30. They have partial,
mm,
collapses, or partial, they're just not going to score the same on a sleep test as men, but their symptoms are huge. Insomnia, fatigue. Insomnia is one of the biggest ones. Women suffer greatly from insomnia, and I think it can be so multifactorial, and I don't think the answer is medicine. I think it's learning how to properly nasal breathe, and learning how to get proper tongue position, and possibly an oral device, if not for snoring, or some expansion therapy, some possibly orthodontic expansion. And there is some really interesting treatments going on, very outside the box, as far as looking at how the cranial bones are very, because we're on this seventh generation of small jaws. We have smaller skulls, and they impact. And a lot of women have temporal mandibular joint disorder. They suffer from migraine headaches, tension headaches, and a lot of that is an architectural problem where their jaw joint is not quite in the right position, whether it's pushed back against the back of their skull, or up. This imbalance that we have is debilitating. So I know many women that are not able, they have these terrible migraines that don't allow them to do daily activities. And so a lot of that can be remedied not just by a dentist, but also possibly by a physical therapist who's trained in working with TMD. But a lot of that is looking at the relationship of the upper skull to the lower skull and the jaw joint, and getting that centered in and balanced. So yeah.
So, really, what we're talking about there is if we're looking at, say, upper airway resistance syndrome, and it does seem to affect more women than men. So, we're talking about the pipe. So, air as we're breathing either in through our nose or if it's coming in through the mouth, and that airflow is to flow down our throat. But if we say, just for crudeness sake, if the throat is narrow, there's an increased effort as air is drawn into the lungs. And it's the increased effort as the air is drawn in that's waking the female out of sleep. But the problem is then she's getting constantly disrupted and taken out of deep sleep, and all the good stuff is happening in deep sleep, such as the brain cleaning itself. So she's spending more
Yes.
time in light sleep. But it must be very frustrating for her because she knows she's exhausted. She's more prone to symptoms that are different to men, such as anxiety, depression, panic disorder, fibromyalgia, chronic fatigue. Okay, so something is
Yes.
going on. She goes and does a sleep study, And during the sleep study, it's not observing that she is actually stopping breathing during sleep, or if she is stopping breathing during sleep, as you said, it may be just 2 or 3 events per hour, which is technically not sleep apnea. But this is how it differs in women to men, because a woman with an AHI of between 2 and 5 events per hour is equivalent to a man with an AHI between 10 and 15 events per hour. So she comes out of
That's
the
right.
sleep study, and I'd like to just your experience of that. She's coming out of a sleep study. Do the doctors tell her that there's nothing wrong with her? Or is it just that the reliance then is because she's got anxiety or because she's got insomnia and she's waking up at 3 o'clock in the morning? She's given a sleeping pill.
So I do see that women are demanding because they need to know, even though they may not test positive for sleep apnea, they are, demanding from their doctors to try to figure this out,
Mm.
you know. And and they've already been through the antidepressants and the all the medications, the sleeping meds, which are really not really great long
They have
term
side
because
effects though the
short
following
term.
day, don't
uh,
they?
They really do. They
Drowsiness,
really
like for
do.
example.
Yes, and you don't get into those deep cycles of deep sleep and REM sleep that clean the beta amyloid proteins out of your brain. So, if you are consistently relying on, and am not a medical doctor, but just you're not getting those you will be possibly more prone to issues like Alzheimer's and dementia if you're constantly relying on medication that appear to help maybe short term, maybe you're traveling a lot and that's that short term, but long term, it's just not the body's natural way to get into sleep. We should have about, more or less 50% deep sleep and 20% REM sleep. So, and often when I don't read sleep studies, but when I'm looking through patients' charts, the amount of deep sleep is very little, and most of the time these women are in light sleep, tossing, turning all night long. They're really not getting their deep sleep, and that's just not healthy. It's just not healthy for the heart. Some women can feel palpitations at night, sweating, night sweats, and you just don't know if you're going through menopause or if it's a result of, you know, um, your body just, waking you up, these disturbances, and a lot of that. It comes to mind that people don't realize that waking up at night is not normal. Our bodies are meant to sleep for an adult 7 to 9, well, 7 to 9 hours a night for children, 8 to 10 hours a night nonstop without waking up. And often waking up, it's your body telling the easiest way for your body to trick you into taking a breath. Take a breath. It's not that you need to use, people end up, it becomes a habit to use the restroom, but the cells in our body are meant to hold urine throughout for hours,
Mm.
7 to 9 hours. We're not meant to get up multiple times per night. That's not normal. And it's become normal. Oh, I get up about 6 times per night.
Mm.
And I'm thinking, well, you're not getting into the,
Yes.
restful sleep. And
So
people are shocked to hear that.
part or a lot of this is stemming back to then having a narrow airway. So say the female then she could be mouth breathing, or I've heard if she's had extractions, or she's having a high narrow palate, or if she's kind of got small features, what you talked about earlier on, that it's the jaws are just too small to house the tongue that you spoke about. So she has a narrow airway, and this is causing her then to have repeated awakenings throughout the night. Now, some of the awakenings she may not realize it but she's just getting taken out of the deep sleep into lighter sleep. But other wakings she is, and then the treatment is more often than not, or at least it can be sleeping pills. How many women then are falling between the cracks and have nothing and just they're kind of just putting up with it? I just find it bizarre, to be honest with you. But you know, that's just as an outsider looking in.
Yes, and I think that it's raising awareness, like these podcasts, that women should get treatment. You know, they should seek answers from their or ask their medical doctor. Well, you know, I may not have apnea, but what can I do? You know, maybe going to you know, an airway dentist who has the resources to teach them about Buteyko breathing, myofunctional therapy. That's a really good place to start. It's not the only place. There are some wonderful collaborative people who help with PTs that are deal with the jaw joint disorders,
Physical
which often
therapists.
accompanies that. Yes, physical therapists are wonderful. And, you know, we have to really look at each individual patient and there's no one size fits all. One woman may do well with myofunctional therapy and some breathing re-education, and another may actually need an oral appliance or orthodontic expansion or uh, physical therapy or some sort of combination of all of these things. And you're right, it's very subtle and very personalized. And I do think that women should be we should we have more issues that need to be addressed. Where our issues are not our solutions are not clear cut as they
Mm.
are with men.
And can I come back
Honestly,
to the personalization then? You know, Danny Eckart's the PAM classification. Is that just related to men, or does that have an application as well in females, such as, for example, narrowing of the airway, the suction pressure at which it's narrowing, lower arousal
so
threshold?
yeah, I really think that whole that the suction issues having to do with mouth breathing creates when we're breathing more through our mouth, our airways become pinched off, right? So, you know, and I myself, I'm looking at my CBCT and I'm like, gosh, my airway is just so small. It's so small. And so it takes time to address these concerns. Sometimes we can make that jaw bigger with orthodontic expansion or some sort of therapy, myofunctional therapy. And but it's a you know, I think on I tell pa my patients that it's like sometimes it's like a 2 or 3 month conversion at minimum to really convert from a mouth breather to a nasal breather. Have you noticed that yourself? That how long it takes
Changing the
people?
habits. I suppose when I'm doing it, I'm pretty intense.
Mm,
You know, when clients come in and really, you know, I might have an unrealistic expectation that in the first session I want to get the ball rolling with it. And when we start talking about the importance of nose breathing and what it does in comparison to mouth breathing, and people then, I think that when the penny drops, um, but you'll have some people as well, they will say that they're a nose breather. And then when we tease it out a little bit, or they might say, okay, when I'm going for a walk, my mouth is open, or I wake up with a dry mouth in the morning, or I might bring a glass of water to bed with me. And we kind of get telltale signs then that they do have their mouth open more often than they think about, but it's that mouth breathing with the low tongue resting posture, which is contributing to the tongue then in a low resting position, which is encroaching the airway and the mandible then falling back. Um, but like I think it's really important. If the other thing is as well that if we can get people to feel better quite quickly, they know there's something in it, and that's why I have kind of an urgency to try and get you know, people putting it into practice, especially with the simple things, you know, and it is just about becoming more aware of it. Or if you have a stuffy nose, doing the nose and blocking exercise. And I think it's tremendous and amazing that there are many dentists who really understand this, because I think a dentist is in a tremendous position that, say, for example, a female comes, I know this, you don't have to say it, but I'm sure that if a young female or even say a 40-year-old, well, which is young, female comes into you and you are she's on the chair and you're looking at her palate, I'm sure that you will identify the risk factors there and that you can inform her to go and get a sleep study. But wouldn't it be brilliant if every dentist was to do that? And if every
Well,
dentist was to provide some approach as well? Because, sorry, without asking that, the other question is females don't have a tendency to go in the CPAP machine. Why is there more of a tendency to take sleeping pills than to try the CPAP, given that it's an upper airway resistance issue?
you know, first of all, in the here in the ADA has mandated as of 2017 that all dentists screen patients for sleep apnea. I didn't know
Wow,
if you knew
that
that.
is brilliant. It's
Yes,
not here in Europe.
yes,
Hopefully it happens soon.
since 2017. However, the problem is there are not enough trained dentists. What do? You refer them to the medical doctor, which is ideal, okay? And the signs and symptoms we look for are exactly inter a small jaw when we measure from the upper jaw, a high palate, dry lips, dark circles under the eyes, maybe a lot of cavities possibly, or a lot of crown and bridge work. So we didn't quite get into bruxism. That's another whole nother rabbit hole. So people who have had a lot of dental work done where not just cavities, but they've had a lot of crowns and extractions. And why is it that I'm constantly, as an adult, needing dental work? And it could be that you're bruxing at night or grinding your teeth. Well, that bruxism is basically your body trying to get oxygen. And the medical doctors have observed this, sleep bruxism, and that's a factor. And so but the dentists really, we all need to work together to connect the dots. So yes, since 2017. And then I forgot the other thing that you had mentioned about the
So in terms
second
of then, if say for example, so it they're with females because their sleep is different than to men, they are more prone, say, to lower arousal
and
threshold. But
yes.
part of that is not just the lower arousal threshold that they wake up quite easy. You also have the upper airway resistance syndrome that's creating the effort, which is there's the two coming in combination. But yet it seems to be, or am I reading it incorrectly? It seems to be that the treatment then for women is more focusing on the insomnic aspect of it or the fact that she's waking up easy, lower arousal threshold to be correct, and not necessarily about the airway. But then again, the CPAP here would be the treatment that would be normally with medicine. So why is there a disconnect there?
That's such a hard question, and I think in this country it's just easier to give a pill than
Mm.
to get to the root cause. And I do think there's a revolution now where we are looking for more holistic or natural ways to treat issues such as sleep and fatigue and breathing. And so I think that there are, especially in my practice now in Walnut Creek, people are reading your books. They are doing research. They are very well educated and they are learning, especially we're pretty close to Stanford, where James Nestor did those breath
Mm-hmm.
studies, and where he occluded his nose. A buddy of his, and they put cotton in their nose, and they developed diabetes and sleep apnea within a week or so. It's kind of shocking. So our bodies just don't work well when we don't nasal breathe and get oxygen. But as far as why do women accept that medication as a solution. I don't know, and I think we just need to be more vocal. I mean, we're always. I mean, as a woman, you're expected to take care of the child, and so I think many women have low arousal threshold, we can wake up at the drop of a pin because that's how our evolutionary process is. We've got to take care of the baby. Maybe that's changed a little bit with role reversal in some families. And it's kind of funny. My husband has very low arousal threshold. He was the one that got up for the babies. I went to work. So that, it can be individualized, but I think that as women, we need to seek more answers from the medical doctors and maybe just keep asking for treatments, looking outside the box, looking something as very non-medication, non-medicinal, such as nasal breathing and tongue posture. It's just fascinating that, and I do think it's starting to happen more and more in the United States, at least, that this collaborative effort of medicine and dentistry and all the ancillary groups that were really coming together. And now, because we are the most unhealthiest people in the world, I believe, right? We've got terrible obesity issues in the United States. And I think that perhaps, we just need to look at, like I said, the root causes of many disorders, which
Mm-hmm.
small
It's
jaws, big tongues.
it's
Yeah.
quite it's a vicious circle as well. Like in terms of all Western civilization, because if we have poor sleep and we're waking up tired, we're going to fuel our body with food that are going to give us a quick fix because we're looking for
Right,
energy. So we
right.
tend to go more for sugars and carbohydrates, and we eat more
And
because of leptin and ghrelin changes, the poor hormone
exactly,
changes.
right. So we
It's
but we don't it circles and these young people and the young people are not doing well either. We all have choices in food. We should try as much as we all know, get the cleanest food possible. But if there's a lot of preservatives in it, it destroys our gut biome, and it is a vicious circle. And are we really moving towards health and getting our bodies to work the way they should, versus intervening with medication or a machine or other modalities? Why not try to get back to it where we should have been, where we can be healthier and our bodies work the way they were meant to. We're incredibly designed system. And we just have changes that kind of detour us, whether environmental or epigenetics, right? Environmental and gene changes. So what we do now, the changes we make now, are going to affect my children's grandchildren, right? The changes in diet and being healthier, with trying to go back to where our ancestors were, right? Proper tongue position, larger jaws. We've got to change the pathway, or we're not going to continue. We really can't continue the way we are. And I think there's so many factors involved with that. The big pharmaceutical, there's a big push. Unfortunately, these companies are doing quite well, just giving us medication and
mm,
medication
mm.
and there's I think that just personally, if we can just be healthier, of course we need advances in science and finding cures for diseases, of course, but if there's a way for our body to be able to function in a healthy way, that I think that's always better, right?
If we turn to men for a moment as well, and there must be some men that are listening to this, and maybe their partner has said that they were snoring and then they're stopping breathing. When you so how would we explain it then, or what would be the signs that a man could pick up on, um, so that they kind of get, maybe they've been told it once or twice, or what's your experience in that when you've got men
Oh,
coming in and you start delving a little bit more? possibly could this person do they need to do a sleep study?
So that's just so funny because I have a lot of men, more men come in for treatment, and their biggest reason for coming in is their wife is nudging them. Either they've got this elbow to the side, or they've been kicked out of the bedroom
There's a sleep
completely.
divorce, which I hear is the
Sleep.
next big thing, huh?
It is, and so they're sleeping in separate bedrooms, and so men often, they don't really realize the connection with high blood pressure or cardiovascular issues or diabetes or cognitive issues, but the bed partner complaining of snoring and gasping, that really drives them. So, men are, and they too listen. They come in, they've tried the CPAP, they can't tolerate the masks or the pressure, so they end up in my office, and so I evaluate them for mandibular repositioning device that gets their jaw into an ideal position and allows them to keep their airway open so that the tongue doesn't fall back and occlude the airway. And then we have other modalities in our office. We use, in addition to myofunctional therapy and breathing re-education, we use laser therapy to help with tighten up the tissue in the back of the throat. It's a CO2 laser. Um, but men are really, and they often. I have this one patient that, um, they say, well, it snoring doesn't bother me. I'm asleep. And so I just think that's just so funny. And sometimes they come in for treatment for mandibular devices. Where they're going on a weekend with their buddies and their buddies don't want to hear them snoring. And so a lot of it has to do with snoring. And snoring is basically vibration of the soft palate. Okay. It's tissue that is floppy and it vibrates and that noise and there's different types of snoring, but the most common is palatal snoring. And so when you have a mandibular repositioning device, getting that jaw downward and forward, that often helps with the snoring, but not always. So you need to do myofunctional therapy and possibly laser treatment. Now, I find that combination really works. And sometimes I have husbands and wives come in. And so when both are treated, and of course, I try to stress the importance that when you're treating your apnea, which is a serious medical condition, I mean, it can be really fatal, then you're giving yourselves 10 extra years
Mm,
by getting treated. People don't realize that. Well, I thought I just snored. I thought it
mm,
was just snoring. Well, no, it is lack of oxygen. An apneic event is lack of oxygen for 10 seconds or more. 10 seconds or more, it could happen 15 times per hour, but that means, that's moderate sleep apnea, but you're not getting oxygen to your brain and your heart and it's all the systems that are affected by an apneic event. And so yeah, men are fun. They're fun to treat, They're often very honestly very easy to treat, because they once they understand the sort of the architectural issues, then they understand that a happy wife is a happy life.
yes. So that saying is over across the pond as well. We don't just hear that
Right,
over here, huh? So,
right.
just drawing it to a close because I think this was a really interesting conversation in terms of just the different aspects from childhood all the way up. So, for people to find more about your work, and of course, as well, you're associated with the Vivos Institute,
I
um,
am.
to where would they find you?
So, people, people like me have an interest. I think there are different societies. So Vivos is a wonderful way to find a dentist that is trained in airway. The American Sleep and Breathing Academy is another organization that I'm really involved with, and just looking for a dentist trained in growth and development devices, especially if you have children. And there is there are dentists out there, airway dentists that are trained in making that 3 foot cage that you have your 6 foot tiger in into a 6 foot cage. So whether it's a combination of orthodontics, or epigenetic devices, which Dr. Singh has taught us. It's signaling growing the jaw, and so making room for that tongue. So there are many organizations out there. The American Dental Association has really stepped up and looked at pediatric sleep issues and how dentists can help, and they understand that early intervention is very, very important. And I just think that organizations that deal with airway and dentistry, there's I think, and medical doctors too, they're really starting to collaborate with, especially in the bigger universities like UCSF and Stanford. They have these units where they have dentists and medical doctors trying to figure out how can we help this child who maybe has some really serious issues. So those are just some of the resources. And I think obviously on your website, whoever's Buteyko trained and who's a dentist really gets it, right? They
Yes, if
really
there are, if
understand.
there's a dentist or myofunctional therapist, of course, and sleep
They
on our website, they understand about breathing, which is, of course,
Yes, they
yeah, it's
do.
huge.
Yeah.
It's huge.
Yes.
So
Yeah.
it was a pleasure, Dr.
Thank
Toshi Hart. I know you were on holiday, so thanks very much for giving me an hour of your time. I think the conversation was great. I think it can be very helpful in terms of the route that you went down. So it was wonderful. So thank you very much.
thank you so much, Patrick.